go.
So my name is Emily, and I'm at the end of the second Hesch course I've taken. I took the lumbopelvic hip course last year, and then this year I took the whole body course. Last year when we were experimenting in class, Jerry looked at my hip and my knee because I'd been having chronic pain. I had a sports hernia injury to my hip where they did a mesh replacement, or they put a mesh in, and I always had pain after that. And I'd had multiple manual therapy treatments to release that, and it never truly got better. I also developed left knee pain, and they did a plica resection, but then I continued to have patella tendonitis for over a year. When I saw Jerry, he did a rib mobilization on my right side, which then released all of the pain and tightness that I had in my right hip. And he also did my femur was posterior. So
At the knee joint.
At the knee joint, yep. So he pulled it anterior, or he mobilized it anterior, and then that took away all of my patella tendonitis pain. So prior to that, I hadn't been able to run more than 1 to 2 miles for a few years, and now, like last summer, I ran up to 6 miles without any pain at all. So it definitely helped, and I have no patella tendonitis pain, and I don't have any hip pain.
And the mesh pain, you had pain in the mesh area?
The pain, I guess the mesh area was kind of the anterior groin hip area, and by doing the rib mobilization, that took all that away.
So some of these are surprising responses. I wouldn't have expected that on the rib mob, but it is what it is. Some things I can't interpret and say this is why, but I just accept it. So anything else? Any comments about the rest of the body course this weekend?
I guess it was just really good to learn all the connections in between the different body parts, and to know that the foot can affect higher up in the chain, and how there's so many different patterns that we're not used to looking for, and how I could be treated for my knee and my hip for years and no one could figure it out, and then there's different patterns out there that you need to go look for. So it's not always those simple things that you learned in schools and that you've learned in other courses.
And so how would you describe the pattern in your knee? It was a posterior femur, and the posterior femur happened at the knee joint, so it was in relationship to the tibia.
Yep.
And I guess what I'm fishing for is, in your own words, basically it requires a long release.
Yes.
It's a dense restriction.
Yep, I had joint mobilizations done before where it was just on and off, and it never touched it. So with doing the long hold and the long release, that then allowed the correct mobility in my knee.
And what do you think happened to the patella when the femur remained stuck posteriorly in posterior glide? Not a lot of glide, but it happened.
Yeah.
What do you think that did to the patella?
It compressed it in the joint, so it was having...
Right. I mean, it pulled it back, right?
Yep.
Yeah. In the same way, the opposite, a knee that stays flexed slightly pushes on the patella, compresses it that way. This one actually pulls it backwards, right?
Yeah.
Very good. Anything else you want to add?
Don't think so. It's
Nice.
worked well in the clinic.
And what's your profession and where do you practice?
I'm a physical therapist, and I practice with Unity Point St. Luke's in Cedar Rapids.
Very good. Thank you so much, Emily.
Thank you.